Hi everybody, this is Life with Hospice. Today I want to talk about the decision between CPR and DNR. This decision seems to be so confusing to a lot of families, mainly because they just really don't understand what it is, what happens when that process is happening. They don't have the right information to make a really good decision. So that's kind of what I wanted to talk about today. You don't have to have a DNR to be on hospice. It's not part of the prerequisite to get admitted onto hospice. But to decide on whether you want to be a DNR or not, I just really feel like you really need to know exactly what CPR is and how it can help or hurt your loved one. So I wanted to read something that I found that I thought it just completely explains it really well. It's by a gentleman named Hank Dunn, and it reads, "What really makes these decisions, meaning hard choices, has little to do with the medical, legal, ethical, or moral aspects of the decision process. The real struggles are emotional and spiritual. These are the decisions of the heart, not just the head." I find that extremely true. It is extremely emotional when a patient and family have to think about this process and whether it is right for their loved one or not. So I kind of wanted to start first by explaining what CPR really is. CPR stands for cardiopulmonary resuscitation. It is a process where when the heart stops, compressions on the chest, where they're compressing the chest down, that will happen to help pump blood through the body to keep the brain and the organs alive. So that process starts, the patient gets intubated, which means that they take a breathing tube and they put it down their throat and then hook them up to a ventilator, which it helps them breathe. So it actually can do all of the breathing for them during that process. Medications are given to the patient and during that process because, and I won't get into like blood gases and all of that, but certain medications have to be given to kind of regulate the pH of the blood. Epinephrine is given to help the heart start. And sometimes the heart has to be shocked by a defibrillator. So all of that process happens, and it's all to try to get the heart to start. It has been found that CPR on a terminally ill patient in a nursing home, somebody who is very ill, has an extremely small chance of survival. And when they do survive or they do get a heart rate back, it either does not stay or that patient ends up dying on the ventilator. So very, very rarely will a terminally ill patient have CPR done on them, and then they just go back to the way they were before the CPR started. So that's always something to keep in mind when you're thinking about making those decisions and whether it is right for that particular person, whether it be yourself or your loved one. So you have to kind of look at the whole picture. And to do that, you really have to look at goals of care. The patient, the family, they need to sit down and really decide on what the goals of care are. To talk about whether if that heart does stop and it does get started, knowing that the patient could die on the ventilator, is the chance of the very, very small chance of survival worth the process that would probably happen, which would be death through a violent ending, or being on a ventilator and having to have that decision made to disconnect. Both of those would be, horrible. Absolutely. So that's why I kind of wanted to talk about yet another thing. There's a story that actually, it just kind of sticks in my mind, that we had a patient in the hospital. She was a young lady, probably in her 40s, if I remember correctly, and just skin and bones. I had talked to the husband about CPR versus DNR, knowing that his wife was declining pretty quickly, and eventually he was going to be dealt with that choice. And at that point, she was a full code, which means you do CPR on the patient completely. And I tried to talk to him about what was going to happen to her if her heart stopped and she continued to be a full code. I explained it to him that she could have a very violent death because of it, and it wouldn't be a nice peaceful death, which is what the goal is. And he pretty much told me he didn't care, that he had to give her a chance. And I really do understand. I understand that. I did try to give him the big picture that chances are, like, she wasn't going to make it through that. She just wasn't. And he pretty much said, I have to do what I have to do. And I said, okay. And afterwards, when she did get transported home and her heart stopped, CPR was started. The ambulance came, took her to the hospital, to the ER, and pronounced her dead in the ER. So, in my opinion, his choice was not the best choice for her. It was the best choice for him at that moment. So I just ask you to really think about that and what the end result will be, and just really think about the patient and think about how they want their life to end and how you would choose to have it end. These are discussions that need to be held before the patient ever gets to that point. Something that a patient can do, which is a complete gift for the family, is to have an advance directive. An advance directive is paperwork that it pretty much dictates how they want the end of their life to go. So if they don't want CPR, if they don't want feeding tubes, if they don't, it has it all in there, and they can make those choices. So when the time does come, it's completely off the family. If they choose to go by the advanced directives, it's exactly what the patient wanted at the end of life. There are times when once a patient can no longer speak for themselves, the family actually has say in what happens to the patient at that point. The advanced directives speak for the patient, but the family does not have to go by those wishes. So it's really important, whatever is in those advanced directives, that family gets told before the event occurs, so it has the best chance of carrying out those wishes at the very end of life. Because like I said, the family can go against them if they choose to at that time. But most of the time, families will go by what is written in the advanced directives because that's what the patient wanted, and it actually makes them feel like a weight is off their shoulders because they're not making any decisions. That family member is making those decisions, and so it's actually a gift for the family. If someone chooses to be a DNR, it is a piece of paper that has a doctor's signature on it, and it says that natural death is to occur. So if a patient goes into the hospital, if the heart stops, natural death will occur, CPR will not be started, and they will be allowed to go peacefully. If you have a DNR in the home, when the paramedics come, all a DNR has to do is be shown to them, and they will not start CPR. If there is not a DNR in the home, it does not matter what anyone says. The family, it does not matter. CPR will be started on the patient. That is just what the paramedics have to do when they come into a home and there is not a DNR present. So just know that if there is a DNR, to make sure that is readily available. So if for some reason paramedics come to the home, whether it be a family member call them or whatever the situation is, that with that DNR, the CPR will not be started. If a patient has a DNR in place and goals of care change, it can be rescinded at any time. A patient has every right to change a DNR back to a full code. There could be many reasons why they would do this. Either they've just had a change of heart and they've changed their mind, or their physical status has changed, whether they're starting to get better, they've decided, it's time to come off hospice, they no longer qualify, they may change the DNR back to a full code. Just know that can happen at any time. And like I said before, CPR versus DNR is a very emotional decision for a patient and family. If you feel like you are struggling with the emotional portion of it, not knowing what to do, just not sure, contact a social worker if you're on hospice and talk to them about that, and they can really kind of help you kind of navigate through those feelings to try to make the best decision for yourself. And for the families out there, letting go of a loved one is very emotional and very devastating. Allowing your loved one to have that natural death isn't giving up on them. It's giving them the gift of comfort and peace in the last moments of their life. It's allowing them to have a comfortable and peaceful death instead of a violent death at the very end of their life. So do not feel like you are giving up on them by any means. I hope this information has at least helped in getting the conversation started to deciding what is the best choice for your loved one. If you have any questions or you need more clarification, you can write me at monique@lifewithhospice.com. Next time, we'll talk about the actual dying process, what to expect. So we'll see you next time.